Hello, you're welcome to my channel. My name is Assessor, registered nurse from Ghana, working in the UK for a while, and I do give tips and advice to overseas nurses who are planning to relocate to the UK or those who are already here to help you adjust in the system. So in today's video, I'm going to be talking about 20 non-hospital based nursing jobs that you can consider, because yes, we need people to work at the bedside or in the hospital. Some people do want to have what we call family friendly jobs, so they can actually have some time with the family and as well look after people as well. So if you want to know more about the 20 non-hospital based nursing jobs in the UK, why not watch the video to the end? So you're welcome back to the video itself. Most of the organizations or the jobs I'm going to be talking about are jobs that you'll find in different organizations. You might find some in the NHS, you might find some in the private sector. The NHS most often would offer you sponsorship. Private sector, I'm not too sure. Some may offer you sponsorship if you are the preferred candidate. So before you consider any of these jobs, you have to actually find out whether they would offer you sponsorship. If not, then it's better to stay where you are. When you get your indefinite leave to remain, then you can move, because at that stage, you're not going to be needing sponsorship from anybody. Now, these jobs I'm going to be talking about are mainly for nurses who are already here in the UK. And also, if you're going to come, it helps you with planning for the future. You can work on the ward for a while, gain all the experience you need, and then you can move out of the ward environment. Before I carry on, if you're new to my channel, you're very welcome. If you've not yet subscribed to my channel, please do so. Subscribe, like, and share as well. If you are a returning subscriber, thank you very much. Anyway, let's carry on. So some of the jobs as well are jobs that you would need post qualification or post registration qualification. Some of them you might be offered training on the job. So let's go through the 20 non-hospital based nursing jobs that you can consider in the future, or if you're in the position to start applying, why not? Some of the jobs as well, you need to be a driver, so that's very important. So the first on the list is school nursing. With school nursing, usually they are band 6, and school nursing, you need to be a registered nurse in order to go and study and become a school nurse. You require, I think it's specialist public health, community public health qualification. You have to go to university. I believe it's about 1 year, but you can look into it. Some NHS trusts do advertise for school nursing training positions. Most often you would be paid as a band 5 whilst you're learning. You need to search online for more information about that. And as I said, school nurses, usually when they finish training, meet their competencies, they are band 6. The next on the list is occupational health nurse. So occupational health nurse as well, you need to have post-registration qualification. Although some organizations may train you, some organizations do have band 5s and they will train you to become occupational health nurse in the future. With that as well, you need to do a course in university. It's about 1 year course to help you become occupational health nurse. And because it's a post-registration qualification, you would be band 6. Some actually, the higher you get there, the more experience you get well paid with occupational health. School nursing, let me go back. You need to be a driver because it's important. And school nurses look after school-age children. They do immunizations. They do all the assessments and all those things. So, look into school nursing and see what is in it, whether it's something you would want to do. So it's a public health thing. So I'm back to occupational health. Occupational health is also a branch of specialist public health or community public health specialization. You also do this course in university. Once again, as I said, I believe it's 1 year post registration training. It's important to be a driver, especially if you're going to be working for a company. So with occupational health, you could be working for NHS, where they actually assess pre-employment assessment and all those things. They would do things like that. Some private organizations, for example, the railway people, a lot of companies do have occupational health nurses to look after the health of their employees with employee checks or accidents at the work site and things like that. So you can look into how to train to become an occupational health nurse. And also, as I said, either band 6 or more if you get more experience. Actually, I met a lady who works for herself as an occupational health nurse, and she works for some agencies, nursing recruitment agencies. So she does all the blood tests, so pre-employment screening and things like that. She was doing them and she was getting paid for it. So why not think about that? Another one, number 3, is continuing healthcare assessor. So these continuing healthcare assessors are nurses as well. You would need some training, but you have to investigate more into how to become a continuing health assessor. They assess people who need extra care. It could be someone who needed a nursing home, and you would go in, assess, and make recommendations and things like that. So it's another thing. So people who have complex care, so they have complex needs assessors as well. So I think they work hand in hand. So look into that. Most of these jobs are 9 to 5 jobs as well, and Monday to Friday jobs as well. The 4th one is healthcare at home nurse or home therapies nurse. So what do they do? Healthcare at home nurse or home therapies nurses are nurses who drive to people's homes and deliver care. It could be IV therapy, someone needs chemotherapy or some sort of IV drugs or any other treatment that they don't necessarily need to be in hospital to receive that treatment. So the home care nurses, actually your home therapy nurses, drive to your home and they go and deliver the care you need in people's own home. You need to be a driver. You need to have cannulation skills as well, because that could help you. I know in my current job, we have patients who use some specific treatment. They need to inject themselves. So we use one of the companies where they send a nurse to go and train the patient as to how to inject themselves. So one of the companies I'm aware of is Lloyd's. So if you check on Lloyd's Pharmacy, Boots as well do recruit nurses. And also, so these are pharmaceutical companies who recruit nurses to deliver these treatments for people at home. And another one, I believe, Alcura. So there are several private pharmaceutical organizations that recruit nurses and send them out to go and deliver care to patients in their own homes. Another one is community mental health nurse. So this would be for someone who is already a mental health nurse and wants to become a community mental health nurse. So this would be for you. You need to be a driver as well. So you'll be sent to people's homes to assess their mental health or deliver the treatment and things like that. So you can look into that. I don't know about the requirement, but I think that would be a band 6 as well. But just Google, if you're a mental health nurse, Google community mental health nurse jobs. All these jobs I've talked about, just Google it, look at what the requirements are. You can go on the NHS job site and search for some of them, look at the requirement, look at the job specification, see whether you meet those specifications, and you can apply. Another one, number 6, is practice nurse. Practice nurses, you need training as well. It's one of the branches of community specialist public health nurse qualifications. They also are on a particular part of the NMC register. So you need post-qualification registration for this. However, or post-registration qualification, some general practices actually do recruit Band 5 nurses, even newly qualified nurses, and they train you to become a practice nurse. And whilst you're working with them, they send you to do the courses that you need to help you do your job. So some of the things they do the smear test, they do chronic disease management, asthma, like diabetes, blood hypertension, spirometry, and there's a lot of things practice nurses do, but they will tell you it's a lovely job. They work either 8 to 5, 9 to 5, some start 7 to 6, but Monday to Friday mainly. So you can look into becoming a practice nurse. I came across an advert online the other day where some universities, I think Birmingham and a few others, about 4 universities, are offering some sort of preparatory course for nurses, from like general nurses who are planning to become practice nurses, where you would learn, and that would help you. You put that on your CV and you might be able to find a practice nursing job. But once again, some organizations may recruit you and train you, as you go. The 7th on my list is health visiting. So health visitors is another branch of community specialist public health nursing qualification. You need to already be a nurse to actually go to uni or train to become a health visitor. They also work Monday to Friday. They look after babies after they've been discharged by midwives. And so they look at the developmental, the growth. They look after the mothers as well, newly, moms or new moms as well. They look after their mental health, for example, postnatal depression. They look after issues around safeguarding. So health visitors do a lot as well. Actually, I did a video with a friend of mine who is a health visitor. You need to be a driver to be a health visitor. Some organizations may recruit you as a Band 5 whilst you're training. When you complete training and you do all your competences, you meet them, then you're signed off to become a health visitor. So it's something to look into. So these are some of the family-friendly or child-friendly, jobs. Salaries might not be as you may want, but if you're already a nurse, you're working on the ward, and you go into some of these areas as well, you can still do bank or agency here and there to support your salary. But, in general, Band 6 salary, so it's not bad actually. The next one, number 8, is immunization nurse. As you all know, during the pandemic, there was a huge need for immunization nurses. Still, every here and there, they do need vaccination or immunization nurses because of the flu and several other things. So it's something to look into, but I don't know about job flow for immunization nurses, but it's something to consider. If you have the training and you're able to do that occasionally, why not? Or as full-time. Number 9 on the list is care home nurse. So some of you are already working in care home, but care home, they don't do short hours. So they do, whatever shift you're offered. It could be long hours, it could be long days, or it could be short days. So it depends. But if it's a non-hospital based nursing jobs as well to look at. Another one is community nurse. So as a Band 5, you can actually apply to become a community nurse. What do? Community nurses need to be drivers, because you're going to be driving from patient to patient. You might be given a caseload of the day. Maybe you have 10 or 12 patients to attend to at particular time slots. So you drive to people's homes, you deliver care as well. You may be doing continence assessment, you might be doing wound dressing, you might be doing insulin injections, so giving specific treatment. So they also do end of life care and several things. So if you're a driver, look into community nursing jobs in the UK. The next one is a research nurse. So research nurse, most often they are either NHS organizations who do their research and they want nurses, or it could be a private organizations or private research organization. So you can look into that. Some of them do actually have requirements. I did a video about how to become a research nurse, so look out for that. And you can go online, find the jobs, see what the requirements are, and if you meet it, why not? If one of them says we will train you as you are employed, why not look into it? Most often research nurses work between Monday to Friday, and they do 9 till 5 as well. If you're interested in academia, you can actually develop yourself whilst you're a research nurse, do your masters, you can do your PhD and be writing papers and doing research and the lot. So you know what, it's something worth looking into. Although most of our Monday to Friday jobs are not, the salaries are not very good, only because we don't do unsocial hours like weekends and night shifts. People who work on the ward and work weekends and night shifts, they do have a little enhancement, so they can be earning a little bit more better than someone at the same band who is working Monday to Friday. So you have to bear that in mind, but you can always top up your salary by doing agency or bank. Another one, I have got number 12. I'm getting there. It's a pharmaceutical nurse representative. So there are some pharmaceutical companies who recruit nurses. We call them reps. They come over, and some of them, if there's a new drug, they come round and tell you about it. They promote the new drug. Some of them actually train people about new equipment that the company might have developed. So they help in promoting these things, and they need nurses to train or promote these drugs. So it's worth looking into. But you know, I don't know about longevity of jobs. Sometimes you meet this person today, next time I hear, oh, they've moved them somewhere else. So that's a bit tricky, but it's good to consider becoming a pharmaceutical rep as a nurse for a pharmaceutical company. The 13th on my list is district nurse. So district nurses also require post-registration qualification. It is also a branch of the community public health nursing specialties, but you can start as a community nurse and you can get trained or go to uni to become a district nurse. They work similar to community nurses, however, they look after more complex cases and manage a lot of things and work alongside with community nurses. So it's good to look into district nursing. Number 14 is insurance claim nurse case manager. So I came across that some insurance companies do actually employ nurses to work with them to, you know, review things for people who are putting in claims. So it's important to look into something like that. Number 15 is nurse analyst. So I've never come across that until recently when I was searching for this. So nurse analysts actually do review medical notes. Also, I believe it's related to insurance companies or medical negligent companies. They want nurses to review case notes for them. So we have nurse analyst jobs. Another one is a medical claim nurse. It's similar to the insurance nurse case manager. So with them as well, medical claim. In this situation, it could be you're working with solicitors. Somebody has put in a claim because they've gone to hospital and something has gone wrong, and they want a nurse to do their bit to, you know, look into situations, do some examinations, maybe do some assessment and things like that. Actually, with the insurance nurses, what happens is some of them can go and do blood pressures and things like that for people who are newly taking out an insurance policy. So look into that. The next one is a disability nurse assessor. There's a lot of jobs out there for disability nurse assessors. This role is about band 6, but some salaries can go up to a band 7 sort of salaries. But I remember a while ago I considered doing that job, and I made an inquiry on a platform somewhere, and people say, no, don't do it, because it's very stressful. But at the same time, there is no job in the UK which is not stressful. Every job is stressful. So it's up to you. You can go into it. They train you to do the job, but you should be someone who is strong-willed, because at the same time you're making decisions, and based on your decision, someone is getting their benefit, disability living allowance or benefit of PIP, or someone's benefit is being declined based on your assessment. They do a lot of assessment. They put a lot of assessment from nurses, doctors, and a lot of health professionals together before they make this decision. However, at the same time, you have to be ready in the frame of mind to be able to do this job. But you can look into it. Another one is a nurse lecturer. So if you're out there and you are interested in academia, you can look into how to become a lecturer, and then you can apply as well. Look on some of the university job pages. Just type in nurse lecturer. You might find opportunities. If you don't meet the criteria, you have to look and see, what do I have to do to become a nurse lecturer? And then you do it. 19th on the list is fertility nurse. So fertility nurses usually either work for NHS or they work for private fertility clinics as well. So it's something you can look into. You can check, how can I become a fertility nurse, and you go for it. The 20th is becoming a service manager or care home manager. So that is management. You're completely out of the bedside. But with service managers, you can actually do the same in NHS, but I'm talking about non-bedside or 20 non-hospital based nursing jobs. I hope this has actually been helpful to you, and so I wish you all the best, and I'll see you again soon. I hope you enjoyed it. Don't keep it to yourself. Remember to like, subscribe, and share, and I'll see you again soon. Bye-bye.